Good morning.
Good morning.
Hi, and welcome to Bladen Online. My name is Erin Smith, and I'm the editor here with Bladen Online, and we're continuing our roundtable discussions this week on the opioid epidemic with Mr. David Howard. He is our Director of Bladen County Health and Human Services. Welcome, David.
Thank you for coming over. I'm glad you're here.
David, what we've been doing is we've been talking a little bit about the opioid epidemic here in Bladen County. And I know from the public health standpoint there is some impact. Tell us a little bit what it is you're seeing here in your office and in the county.
Well, the effects are many, and when you use the word epidemic, for instance, it's really a national epidemic, so we see it from coast to coast, and we see it a lot in the rural counties. The biggest effect on public health is transmission of disease, especially because opioids is oftentimes illicit drug use is going to be sharing of needles and reusing of needles to use injection drug use. We have an example from, I think it was Indiana, a small rural county had a huge outbreak of HIV, and they didn't know where it was coming from, but they found out a lot of it was from illicit drug use, which came from needle sharing. And so it can happen in rural areas as much as for urban areas. And also, an epidemic, by definition, spans a great area. And so what we're seeing is a lot of cross-boundary, across states and across counties effects. So we have a very high rate of use, for instance, in New Hanover, just a couple of counties away. We have 95 running up and down where a lot of drugs are transported between all the way up and down the East Coast. And some of those people in that business set up shop in small rural counties up and down the highways, and that affects our county. And so the biggest effect for us from the public health standpoint is HIV/AIDS, hepatitis C, and a lot of other communicable diseases that can be shared and put people at risk, and the entire community at risk. And I made the point when I talked to you earlier that some people are on prescription meds and they'll function pretty normally for quite a while. So sometimes the risk is not known as far as diseases that are transported within communities without knowing that you're interacting with a drug user. You may be carrying Hep C or some other disease.
Wow. So tell us a little bit, what are some things that you and your staff from the public health standpoint are trying to put in place to assist people?
So we intercede where we can, especially with our patient population. So we do a lot of services, mainly maternal health, child health, and family planning services. And so every time we get a chance, we intercede with the individual patient, but also with their household and community situation. Every person has a certain social network. And a lot of times with drug abuse and drug use, no one really intends to become an illicit drug user. Just as nobody intends to get sick in any other way. But when they find themselves in that situation, they end up in a certain network of people and habits and places that sort of feed that problem. And a lot of times we'll interview people and we'll learn something about their life in addition to their clinical situation, and we'll intercede in that way. We pass that general information on to our partners in the community. And we partner with everyone that we can, the schools, law enforcement, and we all do different things to try to both stem the effects of illicit drug use on safety in the community, crime. Violent crime has gone down in the state quite a bit, but the level of larceny and theft for items to sell to support drug habits has not gone down, and that's a lot of the crime that we're seeing. That is another secondary effect of this, and that affects the public safety, which is our concern as well, and things like that. So we do a lot of partnering. So we see people individually, but we also do some programming and partnering with other community stakeholders.
On your education side, I know y'all have a community education piece. Do y'all do any outreach through that?
A little bit. We're starting to get into coming up with some ideas on how we can intercede from our standpoint. Actually recently heard about some programs where partners in the communities between medical, EMS, the court system, law enforcement, public health, are putting together sort of urgent response teams. because when someone enters the legal system because of drug use, oftentimes, like I said, maybe they never intended to get in that situation and become addicted to illicit substances. A lot of it starts out as what they call recreational use, peer pressure, whether they're young or old or what have you, and a lot of it unravels from prescription drug use for chronic pain, an injury, say, but they get used to it and get addicted. So these teams would, and this response would be a way to entice people into treatment at their first offense, perhaps. And because a lot of times it's difficult to get someone into treatment unless they're ready to go. And the best time, often when they're motivated, is when they're in trouble, especially the first time, when you can probably get them in treatment a little bit easier than if there's their third or fourth or fifth offense. Law enforcement and the courts are not as easily able to divert someone to treatment. And that brings up the treatment question as well, which you may want to talk about. And in Bladen County, as well as a lot of rural counties, there's not a lot of brick and mortar treatment centers for whether it be inpatient or outpatient treatment. So we have, I've talked to the hospital, and a lot of providers in the area see a lot of people who might need treatment and help. But when they refer out, it's often going to involve a trip of an hour to another town where the professionals are located. So we're working on that as well, trying to figure out ways to, at least on a part-time basis, get some treatment providers here in the county. Lightbridge is in town, and there are a few others that are here, but not every day. And that's difficult for patients to get to treatment if they can't pick and choose their days when they go.
And you mentioned your partnerships as well. You have partnerships with Lightbridge and some of those other places as well here through the health department.
Right. When they're in town, we want to know about it because we want to make sure the entire community knows that where they are, what their schedule is, what their professional credentials are, and what their services are and capabilities are, so that we can get people to whatever level of treatment they can possibly get as soon as possible, as early as possible in their situation. And we want to avoid legal trouble as much as possible, because that unravels into difficulty even though they recover a few years down the road. If they get convicted of a felony, for instance, it's going to make it really hard for them to get a job, go to school, get a career, and be self-sustaining. And that's hard on the economy, and that's hard on public health in general, because we end up providing a lot more services from county dollars and state dollars and federal dollars.
Well, David, how much would you say it impacts the public health department in terms of dollars?
Well, it impacts us when we see more than necessary disease spread. As I mentioned, communicable disease is one of our main functions. And the state has, we have 80, 90 different communicable diseases that we track. A lot of them are going to be are very serious diseases that are potentially going to come from exposure to shared needles, if it's illicit drug use using injectable drugs, or otherwise sexual contact, sexual interaction. The lifestyle of someone who is using illicit drugs is such that they're not doing a lot of planning for the future, and so we end up with a lot of impulsive behavior that ends up in a lot of disease spread, which may not occur to such an extent if we don't have that a lot of drug use in the area. So that's a big effect on public health, and that puts everybody at risk, because like I said, one way or another, that things like the diseases find their way around, and that could affect someone who never expected to interact with a certain disease, because they're not necessarily involved in that lifestyle, but one way or another, sometimes some of these things break out of that network that I was talking about that someone might be in.
Well, David, if somebody is looking for information about some of these programs, what would be a good reference point for them?
If they have a medical provider at all, ask them about it, be honest with the provider. Any information, whether you're here at the health department, you're with any other provider, that you share is confidential. And so any provider of any type is going to be interested in helping their patient, their client, get the help they're seeking. I would say that's number one for an individual. If you have a family member, friend, offer to help them make the decision to seek help if they're using drugs, even if they're functioning fine, going to work, and it hasn't devolved into a lost job, lost family situation yet. Encourage them to seek help before they get in trouble with it. And also, there are other resources if you want to volunteer, if you want to get involved in being part of the solution. Then join whatever civic group you want to, and take up the effort to learn about the issue, how it works, and contribute some either professional or lay assistance as you can. I think that's important for the community to rally around problems like this and help their neighbors to both avoid the problem in the first place, and also help those that really need help, because it really is. Illicit drug use is a disease. People get addicted. The brain gets addicted to it, just like alcohol or other things. And some people obviously have a higher propensity to it. So, no, like I said, I don't think anybody starts out intending to get sick and use illicit drugs and lose their job and lose their life. So it's important to remember that they need treatment and help like anybody else with any other disease.
Well, David, thank you for joining us today for our roundtable discussion.
Yeah.
And we just ask that you continue to watch our video series, our roundtable discussions on the opioid epidemic here in Bladen County at www.BladenOnline.com.